Hello, good evening. Welcome to another episode of 1Dokita New Moms Community Class. Today we'll be talking about a very interesting topic to mothers and don't let me leave out the fathers. Today we'll be talking about breastfeeding. So, breastfeeding, we've heard about it, we've seen it. We were all breastfed, or should I say I in particular was breastfed by my mom. What about you? Were you breastfed by your mom? Do you want to breastfeed your child? We'll talk more about this today. What is breastfeeding? What challenges can arise during breastfeeding? What is the importance of breastfeeding, first of all? What challenges can arise during breastfeeding? How can we address these challenges? What can you do to make it better? How can you increase your breast milk supply? What if the challenge could not be resolved? What could occur, and how can you look for a solution to it? This and many more are what we'll be talking about today. So I would urge you to stay close, listen carefully, take note of the points that will be highlighted during the community class today, so that you learn things that you can apply in your day-to-day life as you're breastfeeding, or if it's not for you, for your friend, for your wife, for your sister. Tell them about it so that they can improve their breastfeeding behavior and give their child the very best. So, breastfeeding, what is it? Breastfeeding is simply the act of feeding babies or feeding young children with milk which comes from a woman's breast. That's why it's called breastfeeding anyway. Or you can also call it nursing. You are nursing your child. And what does breast milk contain? In particular, we are talking about human breast milk here. Human breast milk contains fats, carbohydrates, protein, and also it contains water. But in what quantity? Breast milk contains about 3 to 5% fats, about 1% protein, 6 to 7% carbohydrates, and the most significant of all the constituents of breast milk is water. It contains about 88% water. I'm sure you'll be wondering, 88? Am I sure? You can carry out your research and try to find out. Breast milk contains about 88% water. So your child does not need water or any other fluid when you are breastfeeding your child, especially if it is exclusive breastfeeding. We'll still come to that and talk more about that. If you're breastfeeding your child exclusively, you don't need to give any other thing, because breast milk contains 88% water, which is about 4/5 of all what is there. So you don't need to give any other thing. And also, breast milk contains a lot of antibodies that could help your child to build your child's immunity. So it's very good. So the first milk a mother produces is called colostrum. It's yellowish in color. It could be looking a bit orange, deep yellow. It's thick and it's sticky. This milk comes out close to when a woman is going to deliver, or lasts till few days after delivery. It is higher in protein than the normal mature human breast milk, and it is a bit lower in carbohydrates and a bit lower in fat. So the protein that it contains is more. Your baby needs the colostrum. So when you give birth to your child, don't follow all these grandmothers or ancient mothers myths that say you should express it out or something before you now start breastfeeding. No, that colostrum that comes out the first few times, the first few days, is very important for the development of your child. It's very important to build your baby's immunity. It's higher in nutrients. It might be little, but it's enough to feed your baby, and it gives a lot of nutrients that your child will not get after. So when your child is born, his stomach capacity is quite small. The baby is growing, a little chubby baby born, might be taking about very small amount of milk, because what their stomach can take at that moment might just be maybe 5 or 7 meals of breast milk. But as the child continues to grow, the stomach capacity is increasing. It increases to about 45 to 60 meals gradually. By day 7, you see the baby is eating more, and at the same time you are beginning to produce more breast milk to meet up with what your baby needs. And it's very nutritious for your baby. So when you breastfeed, as the stomach capacity is increasing, your body is also increasing what your baby needs. So what is the importance of breastfeeding? Breastfeeding is very important for mother and for child. It helps you to bond well with your baby. Baby is born today. The way you can easily bond, know your baby can know you after delivery is by breastfeeding. It also saves you a lot, in fact, tons of money. If you breastfeed your child, you save money, because if you find out how much infant formulas are sold, 2,000 something, 3,000 something per tin, if not more expensive than that, depending on the products you use. But if you breastfeed your child, these expenses, you avoid them. Also, breast milk is natural, 100% natural, coming from your body. It's renewable. As you're giving your baby, your body is, a lot of processes are going on in your body to refill it, so that you have more to give to your child. There's no package needed. You don't need to put it inside anywhere. You don't need to wash. You don't need to clean. You don't need to do all those problems, all those wahala that you might do because you're using infant formula, you're using packaged milk for your baby. And it is the best nutrition for your baby, like I've said before, because it contains all the nutrients your baby needs in the right proportion. It digests easily because it's breast milk for a human baby. It's not breast milk from a cow or a goat or something processed and being given to your child. So it is for your baby, and it's totally different from any other that you can buy from anywhere. No matter the product, no matter the brand, breast milk is still the best nutrition for your baby. So before we keep going on and on about breast milk, how good it is and everything, nutrition, bonding, I know you'll be wondering, this is something you hear every day. I've come again, all these health professionals, 1Dokita too has joined the crew. They have come talking about how good breastfeeding is for the baby. What about those of us that have challenges here and there? How can we rise against these challenges and still be able to breastfeed, or just stop because of that? It's not easy. We know you're just having a baby, your body is going through a lot of processes, and it might not be easy for you to meet up with what your baby needs. There might be some slight issues that occur. You might even have some medical conditions that makes it harder for you to be able to breastfeed, and in fact some people should not even breastfeed. I'll talk more about that. So you see, there are lots of factors that occurs that would help a mother to be able to breastfeed successfully. In fact, for the first few days, for the first few weeks, for the first few months, a lot of factors, not just one, psychological, physical, everything, nutrition, it's all necessary for you to be able to achieve breastfeeding. So because one person finds it easy, once they deliver, they are easily breastfeeding, and somebody else, once they deliver, it becomes like issue, or from one pregnancy to another, you have issues here and there. Don't start feeling bad, and you should not also judge others because they are having issues. It's not easy. Not like some people do not want to breastfeed, but they are having issues with it. What can you do? Try to help them. That's why it's important for you to listen to the community class today, so you see areas where you can offer assistance and offer help, the right help, or refer them to 1Dokita, and we'll be willing and happy to help them through the breastfeeding process. So what are some of the issues that might occur? Let's look at it in two ways. the mother and the baby. Why some mothers would not be able to breastfeed? They might have some medical conditions such as cancer. Someone who has cancer and has a baby, it would be hard for her to breastfeed because she might be taking some drugs that could be toxic to the baby. So they might even tell her to avoid breastfeeding altogether. Someone that has AIDS, HIV/AIDS also, most times might not breastfeed because she does not want to infect her baby. So she might avoid breastfeeding altogether, or she might breastfeed if she's on the treatment for HIV. So it's a bit shaky. And if a woman decides not to breastfeed because of that, yes, it's okay. Someone who is even depressed, if you've heard about what is called postpartum depression, after delivery a woman falls into depression, it will be harder for her to breastfeed successfully. Why? Because she's going through depression, she might be anxious and all that, and she might even be on some drugs that can affect the baby because of the depression. So this might make it harder to breastfeed. Some people with hormonal conditions like thyroid diseases, it could be harder to breastfeed. And depending on the medications they are using, they might be advised not to breastfeed also. And other disorders, other diseases like diabetes, lupus erythematosus, you might not be familiar with all these words, but these are conditions that can occur that makes it harder for a woman to breastfeed. And in fact, the worst of all, which I can mention, which is quite disheartening, if the mother dies at childbirth, who is going to breastfeed that child? It's really sorrowful, you know. And Nigeria is not a place where you have what we call milk donors. Like, milk donors are people who have high supply of breast milk, and they can because their baby has enough, they can express it, they get tested, it's expressed, stored, and it can be fed to another child. But I don't think we have that in Nigeria. It's something we can work on, innovate, and make it better so that children who lost their mother in birth will be able to still get good nutrition from breast milk. So what about the baby? What conditions might affect a child from not being able to breastfeed, or for a mother not to be able to breastfeed well? Majorly to cleft lip or cleft palate. See, cleft palate is like an opening, or cleft lip is like an opening in the mouth, in the oral region. So when you have this opening, you might have seen it before, some children have stitches. You most likely had a cleft surgery. So when this occurs, there will be a hole in the mouth. It could also go into the palate and prevent it, makes it harder for a woman to breastfeed because the baby cannot form a tight latch or a suction to the breast. So once the child might be trying, but it's hard for the child to breastfeed. So what can the mother do? She might need to express the breast milk and give with a bottle. They might need teats, tubes for feeding, and a lot of things need to be done. If it's the mother can also try to use her tongue to kind of block the clefts, the opening, so that the child can still form a good hold or a good latch on the breast. So, but the most effective way of solving cleft lip or cleft palate is surgery. This can be done between 2 to 3 months for cleft lip, or 6 to 9 months, 9 to 18 months for cleft palate. So these are things that can occur. And there's another one which is not so common, is a tongue tie. If you see in your tongue here, there's a kind of section in between. It's called the frenulum. If it is too tight, it's very hard for the tongue to move, like very hard. So if a child has a tongue tie, it might be hard for the child to have a good suction on the breast. So these are things that can occur when you have your baby. And you might not know this, you just notice that the child is not feeding well. So if a child has a tongue tie, the mother might not know, but she just notices her breast milk might be reducing. Before you know it, you start losing interest because you say baby is not breastfeeding well or something like that. But see your baby's pediatrician, go back to the hospital, let them take a thorough look at your baby to help you better and see what can be done for that. So, but the major things you need to keep in mind when breastfeeding, the major signs that you really need to do something for your baby. Maybe nursing sessions are very short, less than 10 minutes, or very long and the baby is still there. Maybe up to 1 hour, baby is still there. You need to check, is the baby really breastfeeding or not? Or even after feeding, the child still feels hungry, fussy, tired, everything. When the child is supposed to sleep, you need to check very well. Are you breastfeeding well? Or your baby sleeps for so long and misses feeding. For a newborn baby, should at least like every 2 to 3 hours should be breastfed. So if your baby sleeps for more than 4 hours or 5 hours, you need to wake that child up and try breastfeed. You can also try express your milk to see if it's really coming out. That would help you to know if something is going on, if your milk supply is low or not. And one important thing to keep into consideration is the baby's weight. So when you give birth to your child, you check the weight at delivery. So, but the first week of delivery, the first week of your first week of your child might lose some weight, but after that, baby should regain his or her weight. So, and should start gaining like 0.1 to 0.2 kg every week. So if you don't see this, or the baby is even losing more weight, you need to be concerned. That means you might not be producing enough milk, or the baby is not taking enough milk. It can be supply, or it can be that the baby is not taking well. And look at the diapers too. How many times do you change your baby's diapers? How wet is it? If your baby has up to like 6 wet diapers per day, it's okay. But if it's less than that, look at the color of the urine. Is it dark? Is it having like blood stains or something? You need to take that into consideration. And what if you have breast engorgement, like the breast feels so full and painful? These are some things that can happen. So it might make it harder for you to be able to breastfeed. So like we said, the things you need to keep into consideration when you have your child, that any signs, what are the signs that your baby is getting enough milk? That you see when you feed your baby and the baby feels calm, satisfied and easily sleeps without issues, yes, baby is full. Look at the weight. Even though the baby loses a little weight in the first week of birth, after that the baby should begin to gain weight. And also the diapers. If you have about 6 wet diapers every day for a newborn, yes, baby is fine. But if not, take it into consideration. And the stools too, about 2 to 5 stools a day. Not hard, very soft, because it's a baby, they don't have so much in their system. So we should look at that. So if it is less than 2 or once a day for a newborn, you need to take it into consideration, like something is going on. What other issues can you have? Let's talk more about this. This is mother stuff, like other issues you might have during breastfeeding, which you can easily resolve. The baby does not latch well. Like the baby does not form a good grasp of the breast. When you're breastfeeding your baby, not just the nipple, but the whole areola needs to be in the baby's mouth. When you are breastfeeding, don't use this method some mothers usually use, like scissors method. No, you need to use your hand, your palm, and like form a cup shape on the breast, and you'll be able to easily breastfeed. Let your thumb help to bring the milk down. Don't use this method because you'll be obstructing the baby's mouth from having a good grasp on the breast. So you need to help your baby so that baby can latch well. And if it's a newborn baby, try to open up yourself. Let your baby feel you and feel your baby. It's part of bonding. It's a new baby, it's a new mother, so get to know yourself. You can go naked from top to your waist, and also for the baby. so the baby gets used to you, gets used to your body. And you lie down in a comfortable position, enough pillows around you so you can breastfeed easily. And what else can you look at to be sure that your baby has a good latch? Look at your nipples. We even tell you, if the baby does not have a good latch, your nipples will begin to get sore. You see some mothers will say their baby has sharp gum or something. It's actually not the gum of the baby that is the problem. It is the latch. It is how the baby holds onto the breast that is the problem. So you need to make sure the baby is comfortable and the baby's mouth is all over the areola, the dark circle of your breast after your nipple. The whole mouth should grab it well. So it shouldn't feel painful. It shouldn't feel painful at all. So if you are not getting it, watch it again, try and help your baby latch well to your breast. So you can also look at your baby's navel or the belly button. If the navel is coming out so protruded when you are breastfeeding, maybe the baby is not comfortable, try change your position to breastfeed well so that the baby will be more comfortable, be able to latch well. What else can happen? Like we said, the breast might be engorged and swollen. Actually, it might be normal when you just give birth between the first 3 days to 3 days, because your body is trying to produce enough milk to meet up with the demands of your baby. But if this swelling is now so much that you can't bear it, or if you were someone who had fluids when you were in labor, the engorgement might be more. What can you do? You can try to breastfeed more often so that the baby takes the milk and the engorgement reduces. And if it is too much, baby is not taking enough, you can express some of it out so you have relief. And some people say you can try to make use of cabbage, clean, very clean, washed, cold cabbage leaves. After breastfeeding, apply it to your breast. It's attributed to the sulfur content of the cabbage that it will help to reduce the engorgement, to help to reduce the supply. So you can also try that. It's not harmful, and before you breastfeed, you remove it and make sure it's clean, well clean. So what else can occur when you're breastfeeding? Baby might fall asleep. After a few minutes, you're wondering, is this baby even eating? What do? Try to rouse the baby back from sleep so that continue sucking, or you try to express the milk into the baby's mouth and watch the baby sucks continue. So follow the system, you express baby sucks and swallows, then you can continue sucking. And you also keep watching to be sure that there's nothing wrong with your baby. What if the nipples get so pink and painful? That could be an infection. It could be an infection. There's an infection called thrush, so you could have that. So what can you do? You can make use of a lotion. It's called gentle violet. Just apply on the breast about 2 to 3 times a day. Take a cotton wool, dip it into the lotion called gentle violet, apply it on the breast lightly, and this could help to cure it. But if after about 3 days and you still see that this is there, then you need to go to the hospital, see a doctor so that they can prescribe the right drugs, medications for you. So you can call 1Dokita, they pick the call, answer you, and help you with this. What if your child is always breastfeeding, so attached to the breast? Well, it might be normal because, like I said before, babies have small stomach, so they need to eat well. Because just imagine you yourself as an adult, you're told to double your weight in the next 6 months. What would you do? You can eat the whole house. So that's the same process your baby is going through. After being born, in the next 6 months, they have to double their weight. So they might actually eat a lot. And you yourself have to work on improving your milk supply to meet up with the demands of the baby. But at the same time, what could be going on there? Maybe the baby is not breastfeeding well, like we said before. So you need to take into consideration the baby's weight, the number of diapers you use per day for your baby, and your nipples, if they are sore or not sore. So this would give you an inkling if it's actually normal or it is not. So if the baby's weight is not increasing or the baby is losing weight, take the baby to the hospital. Call 1Dokita, tell you what to do. So what else can happen? You might be producing so much milk that the baby is like gulping on the breast, choking on the breast, and seems so like it's not the baby's fault. Your breast milk supply is high. That's what it is. It's like somebody trying to drink water directly from a running tap. It might be so fast, the pressure might be so much that the baby cannot meet up with that. So what can you do? You can actually breastfeed on one breast for a while, for about some hours, before you breastfeed on the other breast. So when you keep breastfeeding and the other breast is full, the milk supply begins to reduce so that it won't be too much. Then by the time you are breastfeeding on the full breast, the other breast which you breastfed from will begin to fill up again. And that's the same process you can do if you want to express breast milk. Maybe you want to express and feed your baby. What if the nipples get cracked? Like we said, if you have sore nipples, it could be the latch, the way the baby grasps the breast. Don't allow your babies to grab only the nipple. Let the whole brown, or if you are a fair person, the whole pink area go into the baby's mouth, not just the protruded portion, not just the nipple. And what else can happen? You could have tender area on your breast. So what can you do? Apply warm compress on the breast. This will help to increase blood circulation on the breast, and it will now make the pain to reduce. So, and whatever is blocking the breast, it would help to relieve it and to go. What else can happen? If you notice like a white dot on your nipple, these are very, very funny things that you will have when you're breastfeeding, and nobody might have mentioned it before. Like I said before, a warm compress can also help. It will help to dissolve whatever is there. It increases blood circulation. Not hot compress, warm. Don't use something that is going to burn you or burn your skin. Just keep it warm, 30-something degrees Celsius, something enough for you to hold in your hand and apply. Dip a cloth in warm water and apply on your breast, not hot steaming water. So those are the things you can do while you are breastfeeding. What if your baby spits after feeding? Like after every feeding, your baby spits frequently. What can you do? If your baby spits too frequently after breastfeeding, this could be normal, because baby might just be a happy spitter. So just take a towel to clean. But you also need to watch if the baby is not vomiting. You need to watch if the baby is not gaining weight. We've talked about it before. You need to keep checking your baby's weight to be sure that yes, this is not something you need to be worried about. You need to keep checking the diapers to be sure it's not something to be worried about. So it could just be that the baby spits a lot after breastfeeding. The baby might be fine. So, and one other funny thing that can happen, I'm sure a lot of mothers can relate to this, that their child bites their breast. This happens very funny. What can you do when your child does something like that? Move the baby closer to you, like to your breast, so that it feels like they can't breathe, and at the end of the day they have to open their mouth and release the breast from their mouth. But if you try to take them back, they will hold on stronger to the breast and it gets more painful. So that is the best way you can do it. Or if you are actually taking recognition of how you're breastfeeding, like your attention is there, you can quickly notice when your baby wants to bite on your breast. Put one finger into the mouth to try to release it from your breast, so that you'll be able to be fine. You won't have any pain or anything like that while you're breastfeeding. So I know we've highlighted a lot of things about breastfeeding. So one of the most important when someone delivers, I know a lot of mothers usually talk about, is their milk supply. They say the breast milk is not coming out. What do? In fact, you need to reduce your anxiety about it. When you first give birth to your child, the breast milk might not come out. But what can you do to help increase breast milk supply before you even have the child? Close to delivery, you should try to be increasing like compress, like massaging your breast to help prepare your breast for the delivery of your child. And if the baby has been born already, what can you do? Reduce the anxiety, get enough rest, plenty of rest, and do what? Increase your water intake. You need a lot of water because, like we said, breast milk is 88% water. So what fills it up is water. If somebody who is not breastfeeding takes about 2 liters of water a day, how much more someone who is breastfeeding? You need more water to meet up with the demands of your baby. What else can you do? Eat good food rich in calcium, food rich in good nutrients, food rich in rich fatty foods. Eat nuts, eat grains, eat vegetables. Spinach is good for you. Moringa is good for you. They contain a lot of nutrients. They are natural and they're good for you. They contain things that will help to increase milk supply. Eat food, eat whole grains, eat wheat, eat millet, eat everything. Don't be picky. Keep eating. And please avoid alcohol, because if you take alcohol, this could reduce your milk supply. Avoid alcohol. So these are the few things that you can do to help you and to help your baby. And if this continues, like the milk supply, despite all these things we've mentioned, the milk supply is not enough, call 1Dokita. We are here for you. We can help out with it. You might need to be on drugs that will be prescribed, yes, to help increase the milk supply in that case. So don't leave it to yourself. First try all these things we mentioned. Get enough rest, take a lot of water, eat good food, eat nice food, ginger, turmeric, everything, all that is all around you, that is going to help you to be able to breastfeed better. And keep taking note of the baby's weight, your number of diapers, and your nipples. These are like the 3 major things that will give you signs that yes, breastfeeding is good, that it's fine, and the baby is doing well. So you see, there's a lot mothers need to take into consideration when breastfeeding, and everybody also should not judge, because some mothers are going through a lot to be able to breastfeed their child. So this is what we have to share with you today from us all at 1Dokita to the new moms community. I hope you enjoyed the program. I hope you took notes on things you've not heard before. Yes, start practicing them. Tell your friends and family about it so that they can also incorporate this into their breastfeeding sessions. And feel free to reach us if you have any questions. So this is where I say bye bye till next week. Thank you.